Welcome. If you're like us, you want to get past the headlines, really understand the deeper story quickly and, properly.
Exactly, and that's what we try to do here. Today we're looking at something pretty significant happening in healthcare and tech.
It's a move that could really send ripples through the whole industry. We've been looking at reports, particularly from a source that tracks business, tech, and power dynamics.
Yeah, and one story really jumped out.
That's Mediclinic, South Africa's biggest private hospital group. They're making a huge move towards artificial intelligence.
And it's not just talk. We're seeing actual job cuts in admin roles, a freeze on most non-clinical hiring. Big stuff.
So the question we really want to unpack today is, what does this actually mean? For Mediclinic, sure, but also for, healthcare more broadly, and maybe most importantly for the people working in it.
Let's get into it.
Okay, so this announcement from Mediclinic, it sounds like a pretty fundamental shakeup.
Oh, absolutely. The reports we've seen paint a clear picture. They're using tech to streamline admin, and, that means fewer admin jobs.
And a pause on hiring for most roles that aren't directly treating patients.
Right, and the engine driving this, it's clearly AI. They're betting big on it.
Not just a side project then, it's becoming central to how they operate.
Seems that way. Now, the information suggests that doctors, nurses, the frontline clinical staff, they aren't the ones facing these cuts directly.
It's the admin teams, the people running things behind the scenes.
Exactly. The receptionists, the schedulers, the file clerks, all those essential roles that, frankly, keep a hospital running day to day.
And for those affected, we understand Mediclinic is offering severance packages.
Yes, that's reported, which is important. Shows some consideration for the impact on staff.
Definitely. But let's also talk about the investment side. It's not minor, is it?
Not at all. The reports mention billions being poured into tech upgrades.
Billions. That really tells you how serious they are about this AI strategy. So what's the official reason? Why make such a drastic change?
Well, according to reports quoting their COO, Bertrand Levrat, it boils down to efficiency.
Efficiency, okay.
The argument is pretty direct. AI doesn't call in sick. It doesn't need breaks. And theoretically, it cuts down on human error in things like filing or data entry.
Right. Fewer mistakes, smoother processes, that classic AI promise.
So it looks like it's that potential for optimization and probably significant cost savings driving this whole thing.
Okay, let's talk money then. The financials are interesting here.
They are. Levrat apparently made it clear they aren't, bleeding cash or anything.
Not in the red, doing pretty well, were the phrases used, I think.
Yeah. So this AI push isn't like a desperate measure. It sounds more proactive.
Trying to stay ahead, as one report put it.
Exactly. And the savings they expect are, they're pretty eye-watering.
Nearly R2 billion by 2027, is that right?
That's the projected figure, yeah. Almost R2 billion. That's a serious amount of money.
Which they say will be reinvested.
Correct. Primarily back into more AI systems, but also into radiology tech. Seems like a broad tech upgrade.
So better systems, faster results, maybe.
That's the idea. Faster test results, definitely crucial for patients. Leaner operations, which, connects back to the admin job cuts.
Right.
But maybe the most interesting bit is this idea of more predictive care.
Predictive care. Okay, what does it actually mean in practice? AI spotting patterns in patient data.
Sort of, yeah. Analyzing huge amounts of data to maybe predict health risks earlier, allow for intervention sooner, more personalized medicine, potentially.
That sounds potentially revolutionary, actually.
Yeah.
But while we're talking about these efficiencies and advancements, we have to circle back to the people affected.
Yes, and this is where it gets complicated ethically and socially.
Because streamlined processes and leaner operations sound great on a spreadsheet, but
they mean real jobs, real people. Receptionists, clerks, schedulers, like we said, the human infrastructure.
It really is that classic AI paradox, isn't it? Progress for the system, disruption for the individual.
Precisely. It forces us to think about what happens when technology moves into roles that were always done by people. The benefits are there, potentially huge benefits for efficiency, even patient outcomes maybe.
But you can't just ignore the human cost. The job losses.
You can't. And stepping back, looking at the bigger picture, Mediclinic's move feels like it could be an early sign of a much bigger shift, an AI-led healthcare revolution, as some are calling it.
Which makes sense, given how fast AI is developing everywhere else. Healthcare, with all its data and complexity, seems right for it.
And the sources we looked at offer some concrete examples of what that might look like. Things like AI reading x-rays really fast, potentially spotting things easily missed.
Or automating scheduling. Anyone who's tried to book multiple specialist appointments knows that struggle. AI could smooth that out.
definitely reduce errors and waiting times, you'd hope. And then there's wearable tech feeding data into AI for real-time diagnostics.
Like your watch telling you, or your doctor, about a potential heart issue before you even feel symptoms.
Exactly. A much more proactive way of managing health.
It all sounds incredibly advanced, but the reports also flagged a concern, didn't they? Is this all happening too fast?
That's the critical question, yes. Are we really ready for this? For all the knock-on effects?
The unintended consequences.
Right, because efficiency and cost savings are powerful drivers. But what about the human touch in healthcare? Does it feel less personal, less empathetic if machines handle more?
Are there risks in relying too heavily on algorithms for health decisions? These are big questions.
Huge questions. So summing up, Mediclinic is making a really bold bet here, doubling down on an AI future.
They're clearly banking on major savings, better efficiency, maybe even better care down the line through this massive tech investment.
And the core thing for listeners to chew on, I think, is this tension. Is this the necessary future for healthcare, fixing inefficiencies? Or does it risk creating something colder, less human?
Maybe introducing whole new problems we haven't even thought of yet.
It's a dilemma.
Yeah. And that final thought from the original podcast source really stuck with me. What actually happens when healthcare starts prioritizing machines?
It makes you think about the core of medicine, doesn't it? That balance between amazing technology and that essential human connection.
Definitely something to keep thinking about.